Hello everyone. Today, we're diving into the world of a medication called fluphenazine, commonly known by its brand names, Prolixin and Permitil. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Fluphenazine, often recognized by its brand names Prolixin and Permitil, is an antipsychotic medication belonging to the phenothiazine class. Its primary function is to manage symptoms of schizophrenia and other psychotic disorders. Fluphenazine works by altering the actions of chemicals in the brain, helping to reduce hallucinations, delusions, and agitation, and promoting clear thinking. It is typically prescribed for long-term treatment to help prevent the recurrence of psychotic episodes. Fluphenazine can be administered orally or via injection, with the injectable form often used for patients who have difficulty adhering to a regular oral medication schedule. Warnings: Fluphenazine comes with its set of precautions. It's not intended for treating dementia-related psychosis due to an increased risk of death in elderly patients. Additionally, it may cause extrapyramidal symptoms, which are drug-induced movement disorders that include acute and tardive dyskinesia. These symptoms can be irreversible. Patients with a history of severe allergic reactions to phenothiazines should avoid this medication. Fluphenazine should be used cautiously in patients with a history of cardiovascular diseases, seizure disorders, liver problems, and those exposed to extreme heat or cold. Before taking this medicine. Before starting fluphenazine, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any other phenothiazines. Given its impact on the brain and nervous system, those with pre-existing neurological conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of symptoms and side effects is advised for those on long-term treatment. You should not take fluphenazine if you have severe central nervous system depression, comatose states, or blood disorders such as agranulocytosis. It's also not recommended for those with severe liver or kidney impairment. Before starting the medication, inform your doctor if you have ever had heart problems, liver problems, seizures, low blood cell counts, or if you are taking other medications that can affect your blood cell counts. It's also essential to let your healthcare provider know if you have a history of alcohol or drug abuse. Side effects: all medications can have side effects, and fluphenazine is no exception. Common side effects include drowsiness, dizziness, dry mouth, blurred vision, constipation, and weight gain. Some individuals might experience extrapyramidal symptoms, such as tremors, rigidity, bradykinesia, slow movement, and akathisia, restlessness. These symptoms should be reported to your doctor immediately, as they might require dosage adjustment or additional medications to manage. Rare but serious side effects include tardive dyskinesia, involuntary, repetitive body movements, neuroleptic malignant syndrome, a life-threatening neurological disorder, and severe allergic reactions. Symptoms of neuroleptic malignant syndrome include high fever, muscle stiffness, confusion, sweating, and changes in pulse and blood pressure. If you experience any of these symptoms, seek medical attention immediately. Additionally, fluphenazine may cause an increase in prolactin levels, potentially leading to galactorrhea, unexpected breast milk production, gynecomastia, breast enlargement in men, and menstrual irregularities in women. Other potential side effects include low blood pressure, elevated blood sugar levels, and changes in blood cell counts. It's essential to have regular medical checkups and blood tests to monitor these effects. Interactions: fluphenazine might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications that can interact with fluphenazine include other antipsychotics, antidepressants, antihypertensives, and drugs that can affect the central nervous system, such as sedatives and alcohol. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking fluphenazine. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The typical starting dose for adults with schizophrenia is 2.5 to 10 mg per day, divided into 2 to 3 doses. Depending on how you respond to the medication and based on your doctor's advice, the dose may be adjusted. For maintenance therapy, a lower dose may be sufficient. For patients receiving the injectable form, the typical dose ranges from 12.5 to 25 milligrams every 2 to 4 weeks, depending on the individual's needs and response to treatment. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on fluphenazine, it's advisable to avoid activities that require full mental alertness, such as driving or operating heavy machinery, until you know how the medication affects you. Given the potential for dizziness and drowsiness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. It's also essential to stay hydrated and avoid extreme temperatures, as fluphenazine can affect your body's ability to regulate temperature. FAQ. Many wonder about the age restrictions for fluphenazine. Currently, its safety and effectiveness in individuals younger than 12 years are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of fluphenazine. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.